All right, welcome everyone. Thanks for tuning in to this episode of the Hawaii Retirement Show. Today we're talking with Candace Nakamoto of Ship Hawaii. We're excited for that. We're going to talk some Medicare basics. We'll talk about what Ship is and the different parts of Medicare, the various enrollment periods, and at the end we'll talk about some considerations for our federal, state, and city and county workers. But yeah, excited to dive in here. Candace, I'll turn it over to you if you want to introduce yourself and tell us a little bit about SHIP and what they do and all the
Yeah,
resources they provide.
thank you, Jason. I am Candace Nakamoto. I am the current volunteer coordinator for the Hawaii State Health Insurance Assistance Program. I've been with Hawaii SHIP for over 8 years now. I'm responsible to recruit, train, and retain the cohort of volunteers that we have. Hawaii SHIP is part of the Department of Health under the Executive Office on Aging. And SHIP receives federal funds to provide free Medicare education and assistance. So we do this work through our volunteers. We train the volunteers, and they are the ones providing counseling. They're providing outreach support through presentations and fairs. So if anybody has any Medicare related questions, they can feel free to call into our helpline. That's 808 586 7299. They can leave a message and a counselor will get back to them and help provide any answers to their Medicare questions.
Okay, great. Yeah, and I think there's a large cohort of people who are familiar with SHIP, but I think there's a lot of people who are a little unsure. And it does stand for State Health Insurance Assistant Program. Um, and I think it's important to note that it's not affiliated with any insurance. I think people get a little reserved reaching out because they think, well, I don't want to be sold anything, right? So
Right.
I think that's an important thing to mention as well. And then the ship program, is it in every state? I know it's outside Hawaii, right?
Yes, there's one in every state and some of the districts. And depending on the state you're in, the SHIP program might go by a different name. Like in California, it's High Cap. In Oregon, it's Sheba. But
Hmm.
they all do the same things, just by different names.
Okay, great. And so some of the services and resources that SHIP provides, you mentioned the counseling, right? So there's
Mhm.
that option you can call in or email and you can go through this one-on-one counseling. What is that kind of like? If you want to just tell us about what kind of questions, can be answered or what is that process like if anybody's interested?
Yeah, so if a person is interested in getting counseling, they could either call the helpline or go through the website and place an inquiry. Our response time is less than 5 business days. So I would say a day or two, you would get a call from a counselor. We can do it over the phone, through Zoom, or in person, depending on the circumstance. And basically, the questions that people call in predominantly are either if they're aging into Medicare, maybe they're still working, they don't know if they have to enroll, they're scared about this lifetime late enrollment penalties. So the counselor can kind of assess their situation and provide information, resources on what they can do. Other kind of questions are maybe they can't afford to pay for their Medicare, so it's to see if they're eligible for any financial assistance programs. Really, there's a wide gamut of questions, but that's usually the bulk.
Gotcha. And then there's also you folks do a lot of seminar or workshop web, I don't know what you want to call them, presentations, right, on all
Right.
different things for I see like a lot of maybe senior living communities or different organizations. You guys can provide some different presentations, right?
Yes, so we do have around 15 different types of presentations, all based on Medicare and the different topics. So anybody with five or more people can request a presentation. It can be through Zoom or it can be in person. And then we would have two or three volunteers conduct those presentations.
Gotcha. And then our neighbor island
Mhm.
residents, those there's opportunities there as well, right? It's not just a Wahoo centric thing.
Right. It's a statewide program. We have volunteers in every county. And typically we pair the inquiries, if it's coming from Maui, for example, with Maui volunteers so they're more aware of the situation on that island.
Gotcha. Yeah, and I just want to give a shout out the website. It's hawaiiship.org, right?
Yes.
And there's a lot of great resources just there if you have questions about Medicare. I feel like, if you're a do-it-yourselfer, you don't want to reach out, if you just go to the website, there's a lot of great resources and like I think there's even some different presentations like recordings, right?
Yeah, if you go on our blog page, we have some PowerPoints, the recordings of the presentations that you can view.
Okay, great. And then you mentioned the volunteering. If somebody wants to get involved, I think it's a great thing. It's from what I've noticed is it's a great community of people who volunteer with SHIP, and I think it's a great thing to get involved if you have some spare time. It really does it makes a difference, and you can kind of see the difference it makes. So if you want to tell us briefly about if somebody's interested in volunteering, how would they go about it, and then the different roles that volunteers have with you?
Sure. If they're interested in volunteering, I would first direct them to the SHIP website. There's a volunteer page which can explain the different roles that we have available. But you can place an inquiry either through the website or the helpline. A staff member will get back to you. We're going to explain the training requirements. It is pretty heavy with the training, but it is flexible, so it's on demand. You can just fit it into your existing schedule. As long as that person is not actively selling like insurance, which could be a conflict of interest,
Mhm.
pretty much anybody can volunteer if they're willing to stick with the training. We do have a 1 year volunteer requirement just because it does take a while for people to get comfortable with the content and fully volunteer. But yeah, there is a training process. We're going to pair you with other volunteers that can kind of help you, guide you through the process, and it fits to your schedule, so
Mhm.
it's really flexible.
And your different skill set, right? You don't, not everybody needs to, give up and give presentations or,
Yeah,
there's different
there's
opportunities for different skill sets.
the counselor role, the presenter role, the exhibitor. We have people who do information distribution, admin. So we would kind of query you when you first start what positions you're interested in. And then after you do the Medicare training, we would kind of have you shadow, try out different events, find a role that fits with you and your skills and your interests.
Okay, great. Okay, awesome. Well, let's jump in. This might bore some people, but I feel like no matter how many times you review the basics of things like Medicare and like sometimes I'll have estate planning attorneys on and the basics just trip people up. And I think you never can go over it enough. So if you don't mind, we'll just kind of touch on the different parts of Medicare and explain, high level of what they are, who maybe is eligible for which one and how it all works. So I guess we'll kick it off with part A, if you don't mind
Okay.
just giving us an overview of that.
Part A, so that's like your inpatient hospital coverage. It will also cover short-term skilled nursing facility care, so that's up to 100 days. It also covers hospice, end-of-life palliative care, as well as home health care. Um, so Part A is typically premium free for most people if they have 40 quarters or 10 years of work credits. If you have less than that 40 quarters or 10 years, it is possible to buy into Part A. In 2026, they released the premium amounts. So if you have 30 to 39 work quarters, it'll be $311 a month.
Hmm.
And if you have less than 30, it's $565 a month.
Gotcha. And how I remember it, and this is probably an incorrect way of remembering it, is like part A is like really bad stuff, hospital. And then part B is like not as bad, right? You're going to see your doctor, right? So I guess we'll jump into to part B.
Okay. Part B is like the outpatient, the doctor services, x-rays, lab tests, emergency room, durable medical equipment is like your walkers, wheelchairs, canes, and preventive services like flu shots, health screenings.
Mm-mm. And then I find this, and I'm curious if you get this question a lot, is sometimes there's confusion about long-term care.
Yep.
And I think what happens is, and I even still get tripped up over, okay, what is a skilled nursing home versus home health and hospice and long-term care? But I think it's important to note that Medicare does not cover what is known as long-term care, right?
Right, because a lot of people want the long-term care for assistance with like daily living tasks, personal care. But Medicare itself does not cover any long-term care insurance, even Medicare Advantage. If a person was interested in long-term care insurance, Medicaid, people with limited income and assets, they offer long-term care. Also, people can purchase long-term care insurance policies separate.
Mhm.
Yeah.
Okay, so let's talk about um, Medigap. Now, this always trips me up too because for the listeners who might know or don't know, you might think, well, Medicare Part C is Medigap, but it's important to know the distinction between Medigap and what is Part C, because Part C is your Medicare Advantage, and that's kind of you're going outside the Medicare program, sort of, so to speak, like to a
Right.
third party to buy, whereas Medigap is kind of still under the Medicare umbrella, right? Am I correct there?
So yeah, they're both sold by private insurance companies, but Medigap's kind of coordinate only with original Medicare, versus Medicare Advantage is like an alternative to the original Medicare. Um, they're both so Medigap is like a supplement insurance policy, so it's gonna cover the out-of-pocket costs that Part A and Part B do not cover. Because typically Medicare is an 80-20 relationship. Medicare pays 80%, you pay 20. But if you have a Medigap and you pay an additional premium, you could get coverage for extra co-pays, deductibles, other benefits. So that is an add-on option if people want to stick with original Medicare A and B, if they want help with the out-of-pocket costs.
So let me ask you a question that I'm sure probably gets asked to you, and it's really broad and hard to answer, but I'm sure somebody would say, well, what is better? What do I need? Medigap, or do I need to get a Medicare Advantage Part C plan?
I think, like you mentioned, it's hard to answer that because it depends on everybody's situation. Not two people have the same drugs, financial assistance, what they want in a plan. I would say there's positives and negatives with original and advantage. It just depends on what we say is fast forward the film. I mean, with Medigaps particularly because you can purchase a Medigap any time of the year, but there are better times to purchase that will give you no medical underwriting, best prices. So that's typically 6 months after you sign up for Part B or during guaranteed issue rate periods, like specific situations. So I would say one, do you need a lot of coverage? Like, do you anticipate a high out-of-pocket cost because you have a lot of surgeries, doctor's visits? Maybe a Medigap could save you on the out-of-pocket end. Also, considerations are like supplemental benefits, like vision, dental, hearing. Those types of things are not included with original Medicare. You would have to find individual plans. Usually, the MA plans will cover routine or comprehensive benefits. So there are pluses and minuses on both sides.
Gotcha. And so uh looking at the Medigap versus Medicare, now I know there's a lot of different I guess providers out there, right? You have your of these things. But if somebody has one that they like let's just say for instance it's HMSA or it's whatever, whichever one it is, right? Is that available under the Medigap and the Medicare Advantage umbrella? Or is it only under the Medicare Advantage? Is Medigap not going to cover if somebody has a particular um, insurance that they want to keep?
So the Medigap, right, would only work with the original Medicare. So if any
Okay,
providers that accept original Medicare, your Medigap's good there.
gotcha.
With the Medicare Advantage plans, though, it's important to check with the providers to see which carriers they accept, especially because Medicare Advantage has PPOs and HMOs, and that kind of
Right.
gets, yeah, we can get into that a little bit later.
Okay. And then so to round it out, we got Part D. Now, Part D is prescription drugs. So if you want to tell us a little bit about what that is and how that maybe works with what we just talked about, Medigap and Medicare Advantage.
So Part D is a standalone prescription drug plan because A and B do not cover all drugs. So this is more the outpatient medications that you take in the home. And so the Part D plans are also run by private insurance companies that contract with Medicare. They range from this in 2026, $0 to I believe 100 something dollars a month. So each drug plan has a list of covered drugs called formularies. And when before you even sign up for a Part D plan, you want to make sure if your drug is on the formulary. So people can do that through going on Medicare.gov. There's a free plan finder tool. You can enter in your medications, your pharmacies, and it will tell you an estimated out-of-pocket cost for the entire year
Hmm.
for each medication. So it's very helpful.
Gotcha. And so if somebody was on A and B
Mhm.
and they wanted prescription drug coverage, they would sign up for Part D. Does Part D ever get kind of wrapped in with Medicare Advantage, or is it always a standalone?
So the Part D is a standalone, but there is a thing called MAPDP, a Medicare Advantage prescription drug plan. So there, Medicare Advantage plans by law are not required to provide drug coverage, but I would say around 90% or more do.
Hmm.
So if your Medicare Advantage plan provides drug coverage, it's known as MAPDP.
Gotcha. And then, yeah, no, that's good. I think we can leave it there for just the basics of the different parts. Maybe we'll talk about the enrollment periods. And this is another one that I think gets a lot of people tripped up because there's several acronyms and different time periods. So if you want to go over just the initial enrollment period, what that relates to, and the timing of it.
The initial enrollment period will be different for everybody. It's a 7 month window and it's based on your 65th birthday. So it's typically people who are not born on the first day of the month. Their 7 months will be 3 months before their 65th birthday, the month of their birth, and 3 months after. If they are born on the first day of the month, it is 4 months before their 65th birthday, the month of their birth, and 2 months after. During the 7 month window is the first time you can really apply for Part A and Part B, and then decide, do I want that original Medicare route or the Medicare Advantage? Typically, you would have to enroll into Medicare during the IEP unless you have other creditable coverage because you're still working or you have other forms of insurance, then maybe you can delay enrollment.
And does Medicare or somebody will people be notified? Like I'm just thinking maybe you're traveling, you got a lot going on, and you might miss the window, but most people will get kind of notified. If not, I mean, it's pretty hard to miss your 65th birthday, right?
Social Security does send out a welcome to Medicare packet when you're approaching that age.
Okay.
If you're collecting Social Security benefits by the time you turn 65, you're already going to be auto enrolled into A and B. But if you're not collecting Social Security, it's really on the onus of the person to contact Social Security to sign up during their initial enrollment period.
And I know this gets a little detailed with all the different parts, but there are penalties, right? If you do miss this window, can you touch on that a little?
Yeah, so parts A, B, and D have penalties. Part A penalty will only apply if you pay a premium. So those that get premium free A, they can't penalize on $0. But the Part A penalty is not a lifetime late enrollment penalty. It's only for twice the number of years. Your Part A premium will increase for 10%. So
Hmm.
let's say I'm 2 years late, my Part A premium will increase 10% for 4 years. After the 4 years, it will go back to normal. Part B and D are lifetime late enrollment penalties. Part B penalty in particular is larger. It's 10% of whatever the Part B premium is in the year that you're enrolling for every year that you were late. So if I'm 2 years late, 20% of the Part B premium in 2026 is $202.90. So 20% of 202 will be added in addition to my Part B premium every month for as long as I have Medicare. And the Part D one is smaller, but it can add up. It's
Yeah.
1% of like $39 for every month you're late.
Gotcha. Yeah, it definitely can add up. And so it's definitely worth marking your calendar, not missing it, missing those enrollment periods. The initial enrollment period. So now we're going to move to the general enrollment period. Can you tell us about that?
So let's just say you missed your initial enrollment period. You can't enroll into Medicare anytime. The next available time you can enroll into A and B is the GEP, which is January 1st to March 31st. Your coverage will take effect the following month. And usually during the GEP, you will get penalized because that's because either you didn't know you had to sign up, you didn't want to sign up, other reasons. But Medicare does not see that as not a reason not to enroll. So you likely would face a penalty during that time.
Gotcha. So the general enrollment period is really for those who missed the boat on signing up in the initial enrollment period.
Right.
Now, there is also the special enrollment period. So let's say you missed the boat on part B and D because you still have, like you said, what is the term, credible or
Yep,
service through your
credible.
employer? And then you retire. You leave your employer and now you want to sign up for the B and D or Medigap. This is known as the special enrollment period, right?
Yeah, so for the people that have that creditable coverage, which means as good or better coverage, they have a special enrollment period window where it's 8 months from the time you lost your creditable coverage to sign up for Part B, 63 days to sign up for a drug coverage. And during that window of time, you will not get penalized for enrolling late. If I wait longer than those two time frames, I will get penalized.
And so if somebody's leaving, I'm just trying to think of the timeline and logistics. So if somebody's gonna retire in, let's say they're gonna retire in February. And so they don't want to go any time period without coverage, right?
Right.
So they would start the kind of process prior to what is going to be their special enrollment period, right?
Yes, I suggest maybe a month or two in advance. You would want to start to reach out and you would apply through Social Security for A and B first. You can actually tell Social Security when you want it effective.
Okay, gotcha. And then we got two more enrollment periods to cover. Next one would be the annual open enrollment period. And then there's the Medicare Advantage open enrollment period. Can you break those down for us?
The open enrollment period is what we're currently in. This is October 15th to December 7th. And during this time, anybody on Medicare can make a change to their coverage. So they're not stuck with that one plan that they sign up forever. Every year, you'll have opportunities to either switch from Advantage to a different Advantage, go back to original to MA. And so people want to assess their coverage. Is their current plan really the best one for them, or is it changing and they want to explore other options?
Mhm.
If they make any changes during open enrollment, it'll take effect January of the next year. The MAOEP, the Medicare Advantage open enrollment, is just for people on Advantage plans. If you have original, you cannot make any more changes during this time. That's January 1st to March 31st. You can make a one-time change to a different Advantage plan or go back to original.
Okay. And then is it possible during these during any of these enrollment periods, what if somebody signed up and they're on part A, B, and they have a Medigap as well, and later on they want to move to an Advantage or vice versa from a Medicare Advantage to Medigap. That's possible, right?
It is. I think just for considerations, if you previously had a Medigap and you're switching either to a different Medigap or an Advantage, we mentioned the best price, the Medigap open enrollment guaranteed issues. You might not receive the best price for a Medigap plan again if you switch out.
Hmm, gotcha. Um, Okay, I think that is a good high level. Again, I feel like Medicare is one of those things that is it can be very straightforward, and then with certain situations it can get incredibly complicated really quick. Um,
Right.
but I think we'll table it for there. We'll stay high level with this. Let's go on to considerations for federal, state, and city and county workers. Um, and some of these considerations probably apply to people in the private sector as well, depending on their health insurance. But I feel like for the federal, state, and city county workers, how the plans integrate Medicare with it would be EUTF for our state workers, and then is it the FEHB, the
hmm
Federal Employee Health Benefits? Can you talk a little bit about those two?
So for the EUTF, the state, city, county, while the employees are working and they're covered by their health insurance, it's considered creditable. So they can possibly delay their Medicare enrollment, specifically for B and D, till after they retire, because most of them have premium Part A. Um, and when they retire, EUTF will require retirees to sign up for A and B to retain their EUTF retiree coverage. And when they retire, they only have three plan options, HMSA, Kaiser, and Humana, that are specially negotiated with those insurance companies. So they're unlike the typical Medicare Advantage plan counterparts. So there's specific rules on which plans are available, but they also get Part B reimbursement. And depending on when they enter the state or county, their spouses can also have retiree insurance as well.
Gotcha. Okay, and then the federal.
For the federal, so similarly, when they're working, they're covered. They can delay Medicare enrollment, but unlike the state, city, county, when they retire, they have the option to either sign up for Medicare or just have their federal retiree, or they can have both. That's not a contingency to continue to receive retiree insurance. So
Mhm.
the federal people will really consider cost. Is it worth paying the premium for Part B? Um, for more coverage, but if they decide not to have Medicare, later on they change their mind, the penalties will come into play.
Can you tell me in your experience, and I don't want to say this as if people should follow this as a rule, but what is the most common approach that you see from federal employees as far as do most of them sign up for B and or is it hard to say?
It's almost split from the people I talk to. Some just sign up just as protection and they want
Mhm.
the extra coverage. But keep in mind, a lot of the federal people also have IRMAs, income related monthly adjustment amounts, because they have higher incomes. So that's even more cost. But if people can swing it, they want to pay the extra just for the peace of mind. They do. But I've seen a good amount of people who are okay with the federal plans. They don't foresee it changing so much. And so they just want to stick with that. I think there's really good resources out there that talk about pros and cons of signing up versus not signing up.
Hmm.
So that's the major decision they have to make. Yeah.
Gotcha. And then one thing we didn't talk about, and it's not really part of this conversation, but it is kind of tied into Medicare, is Medicaid. Um, some people might get those confused, but if you want to talk about what Medicaid is and how it's different from Medicare, and then also too, I'm curious, does SHIP kind of help people navigate Medicaid as well?
Yeah, so Medicaid, that they are very similar names, so people get confused. Medicaid is a state and federal run program versus Medicare is just federal. So Medicaid is specifically for people that have limited income and assets, and it's not just for older adults. There's people who qualify as adults, pregnant women, children. They have different categories, and they're looking at specifically with older adults and people with disabilities, their income and their assets, and that's based on their basically their reported income tax. So they're looking at
Mhm.
the household amounts, and every year the federal poverty levels change, and so the amount for the qualifications change. But if you qualify for Medicaid, essentially that's like a whole nother health insurance. It's going to cover benefits that Medicare does not, like transportation, long-term care insurance. These are the things that people really are looking for. But it's very, very hard in Hawaii to qualify because it's so low, the income asset limits.
Mhm.
But if you can qualify, it's potential to even have Medicare and Medicaid together and
Mhm.
working for your health insurance. And SHIP does help. All of the counselors are trained to screen for eligibility based on the income and assets. We even have some volunteers who are trained to complete the applications with the clients. We don't determine like qualifications or eligibility. We just send it in to MedQuest, which is the Hawaii Medicaid office, and they will make the determination.
Gotcha. Okay, that's good to know. And then circling back to Medicare again, paying for Medicare, the most common avenue is probably through your Social Security, right? But let's say you're delaying Social Security for whatever reason that is, you do have the option to pay other ways. And even if you are claiming Social Security, can you still opt to pay directly to Medicare?
There's a few ways, like you mentioned. If you're collecting Social Security, it's just auto deducted. You have to
Hmm.
go through that method. But if you're not collecting Social Security yet, you can either create a Medicare.gov account, which is the official Medicare website. You can link up credit cards, debit cards to auto payments there. Or there's a thing called Easy Pay, which you can link up your bank account to make auto payments. If not, it's going to be billed quarterly to you, whatever fi address you have on file with Social Security.
Gotcha. Okay, well, great. Yeah, I think that's a good high level review of Medicare. I just want to touch on some things, and most importantly, bring you on and kind of tell the listeners about what SHIP is. Let them know that they're there if they do have questions. And I'm sure during the enrollment periods is probably when most of the questions start coming your way, right?
Yes, I think on the last open enrollment, we had 6,000 inquiries. So,
Wow.
yeah.
That's great. No, it's a great program. I'm happy it's there. For anybody who's got questions, feel free to reach out. And for those looking to get involved, reach out as well to volunteer. Um, yeah, Candace Nakamoto from Ship Hawaii, thanks so much for your time. I really appreciate you coming on.
Thank you.
The opinions and statements presented on this show are for general information only and are not intended to provide specific advice or recommendations. Never make any investment or financial decisions based on information offered on this show without first consulting your financial, legal, or tax advisor. All economic and performance information mentioned on the show is historical in nature and is not indicative of any future results. All indices mentioned on this show are unmanaged and cannot be invested in directly. All information is believed to be from reliable sources. However, we make no representation as to its completeness or accuracy. Lastly, all opinions expressed by Jason Cutitta and any guests on the show are solely their own opinions and do not reflect the opinions of or are endorsed by Toba Financial. For Jason Cutitta, investment advisory services are offered through Toba Financial LLC, a registered investment advisor offering advisory services in the state of Hawaii and in other jurisdictions where exempt from registration.